Well, if you do not have health insurance, you're not alone. More than 720,000 Marylanders are uninsured. In Prince George's, Montgomery, Anne Arundel, and Baltimore counties, including Baltimore City, 376,000 people ages 19 to 64 are currently uninsured and not eligible for Medicare or Medicaid. But there is a federal program that targets this group. Rochelle Metzger has the story of a local woman who says it's helped her get her life back.
Playing with her 2 young grandchildren, Judith Jones knows she's come a long way in 6 years.
All my life I have paid my bills. You know, I worked hard. I put 3 kids through college. Even after my husband died, I kept up with everything until insurance and sickness.
Jones was living in Connecticut, running a small publishing company and paying for health insurance, when in 2006 she reapplied for a higher deductible plan. To her dismay, she was not only denied, her policy was canceled after her carrier determined that being overweight and suffering from COPD made her a bad risk.
And then about a year later I had a stroke. And of course I had no insurance. I actually waited 2 days to go to the hospital, hoping it would just resolve itself.
But when her mouth and throat went numb and face muscles started to sag, she knew she had to go to the hospital. Medical expenses adding up, she applied for other insurance plans to no avail. Treatment for gallbladder disease put her over the edge.
Between the doctor bills and the hospital bills, it used up all my funds for running my business. So I could no longer run my business. So that went. And I could no longer keep up with my mortgage payments. So that went.
Jones lost everything. Forced to declare bankruptcy, she came to live with her daughter in Beltsville. Familiar with the Affordable Care Act, Jones did some research online and found she qualified for the Maryland Health Insurance Plan, or Mhip, which provides coverage to residents unable to obtain individual coverage for 6 months or more due to a pre-existing condition.
To me, they subsidize you, but it's not like charity. You're paying a substantial amount every month, you know, and it seems reasonable to me.
The 61-year-old says signing up was easy and has a message for others who may be in a similar situation.
Well, I tell them to check it out because I think when they find out the reality of it, they'll want to do it.
She now has a regular family physician and says her health today is much better.
I'm much more physically active and doing a lot more. Also, I think it's because I'm a lot less stressed that my blood pressure has actually dropped down to something approaching normal.
Despite all she's lost, Jones knows what matters most is Micah and Lyriel have their grandma.
I lost pretty much all my money and in my house and everything, all these things that I accumulated over the year. But I'm here, I'm taking care, I'm lucky, I have my grandchildren, my children are great, you know. Those are the important things, right?
In Beltsville, Rochelle Metzger, CTV News.
And to learn more about the Maryland Health Insurance Plan, you can log on to getmdhealthcare.com. Tomorrow, Maryland Health Secretary Dr. Joshua Sharpstein will join us in the studio to talk more about the federal program as well as the Affordable Care Act.